Okay, great. Well, thank you all so much for being here. As mentioned, I'm one of the pediatricians at Barton and relatively new to the community. I just moved here over the summer and started at Barton in August. And we have been loving it here so far. And probably similar to many of you, I am also a parent of young kids. I have a almost 5-year old and then an 18-month-old at home. I wanted to choose this topic because a lot of this information that I'm going to talk about is stuff that I would wish that I had a little bit more time to talk about during just regular well visits, because I think it's just such important stuff to know about the early years of kids' lives, in particular if you're a parent or a caregiver. Um, and just to give credit, a lot of these slides were organized by the AAP, the American Academy of Pediatrics. And they really were organized for healthcare providers, but I tried to choose ones that I thought were most applicable to parents and caregivers and just members of the community. And then I think the last reason for choosing this topic is really just that parenting or caring for young children is just really challenging overall. And I think it's nice to highlight how important the work is and how it impacts the development really over the course of the lifespan. So we'll go ahead and get started. This quote here is really just like the thesis of this whole presentation, and that is the importance of nurturing relationships in early childhood. And that's really what builds their brain and lays the groundwork for their overall development. And then this is just a brief outline, just so you know what we will be covering. I'm going to talk about just some basic concepts of early brain development, and then go into the basically what happens if a child faces adversity early in life. What are some of the long-term implications of that? And then how we can promote healthy brain development overall. And lastly, just some resources that I think are important and wanted just to highlight for the community. So the first is really why this is important, which I've kind of alluded to already, is that we know now that the experiences that kids have and the environment that they're in the first, especially 1,000 days of life, have a profound impact on their overall development, including their social, emotional, intellectual, and developmental paths going forward. And we really think that it's so critical that it affects most things going forward. And then we also know that if a child faces something that we term toxic stress early on, that this can have long-term negative impacts as well. But if we can intervene early, we can basically buffer some of that stress and turn things around for the positive as far as developmental outcomes go. And we're going to talk a little bit more about toxic stress and what actually that means. So first, this is just to give you a visual of what brain development looks like from infancy through the first 5 years of life. And as you can tell, these are MRIs of brain. So actually pictures of the brain that look quite dark when you're over on the 3-month side and then are super bright over on the 60-month side. And basically what that is showing is that we know that we're born with neurons, which are the functional brain cells that do the work of the brain. And then over time, a process called myelination happens where the myelin forms around these nerve cells, and that helps develop connections between the brain cells that affect brain functioning. And so as the brain is getting more white, you can see that all of these synapses or connections are being formed, and what a big difference there is between 3 months and 5 years. And then this is just a visual to show just the sheer size difference in a newborn brain compared to a 2-year-old brain. So as the graphic indicates, it basically triples in size by 2 years old, which is pretty incredible. And then now we're just going to move into what it looks like when a child does face some adversity early on. And I think one of the most important studies in this field really is the ACE study, or the Adverse Childhood Experiences study. And this was a study that was conducted by Kaiser and the CDC in the late 90s. Oh, sorry, the light turned off in here. And so it looked at assessing some of these risk factors like child maltreatment and neglect, and then other household dysfunction, and then followed these people to see what the overall implications were, what the long-term outcomes were. And the findings do suggest that facing childhood adversity increases your risk factor for a number of illnesses and other overall poor quality of life. So things like obesity, heart disease, mental illness the rates are much higher if kids have faced adversity in their early years. And then this slide is basically giving some examples of what some of these categories actually are, like what were the adverse experiences that were studied. And the first two categories are abuse and neglect, and then the other categories, starting at household mental illness, or other forms that they have deemed household dysfunction. So things like having someone with mental illness or substance use or domestic violence in the household are all considered adverse childhood experiences. And then on the right, we're looking at what they have called an ACE score that basically looks at the number of these experiences that people have encountered. And what this is trying to show is that they're actually very common. So even in the 4 or more category in this study, which was very large, 15% of women had experienced 4 of these ACEs. So not at all uncommon for kids to experience things like this. And now we're just kind of moving into how do we think that these experiences affect brain development. And what we think is that exposure to this high level of stress from adversity, if there's no buffering, if there's no support in a kid's life, will start to have negative implications on the brain. And this is just further defining toxic stress. So we know that some stress is obviously not all stress is considered bad stress. Like some challenges kids handle just fine. But the distinction is really that toxic stress is long lasting, or it's happening a lot, or it's just very severe. And some of the examples are listed here on this slide that you probably wouldn't be surprised by. Physical or emotional abuse or severe neglect are potential examples of toxic stress. And then this data is actually not from the ACEs study, but it's from a different study looking at pretty similar risk factors, things like abuse or neglect, and then things like parents with a substance use issue or an incarcerated parent are considered risk factors in this study. And it shows that basically as the number of risk factors increases, so does the risk of kids having developmental delays. And this study actually is looking at 3-year-olds. So you can tell that, you don't have to wait till the end of someone's life when they're developing heart disease, or middle age when they're developing heart disease. You can actually see some of these adverse outcomes by age 3 in changes and differences in development, which I think is pretty powerful. And then the next couple concepts, we're just going to talk about what we think some of this stress does to the brain, and why there are such negative implications for experiencing this type of stress. The first is a concept called epigenetics. So we know that we're born with our genome, and our genes kind of are what they are when we're born. But not all genes are expressed in a predictable way, essentially. And so we think that when someone undergoes stress, that some genes might be expressed more, and some might be expressed less, basically. So stress can change the way that our genes function and affect our body without changing the gene itself. And then this is just one example of this. There was a study looking at mothers who had undergone high stress levels and then looking at the DNA of their adolescents several years later. And they could actually see differences in methylation levels on the DNA. And methylation is really what people will consider like a dimmer switch on genes, so decreased expression in certain genes. And then the next concept is that we think that the experiences can also change the way the brain forms. So its physical form is also affected. And this is one of a few models I put on here, basically just as an example, but you can just so you can have a more concrete understanding. We think that kids go through this experience that's at the top. They might have some epigenetic changes that changes the way that their genes are expressed. And then we also think that it changes the way that the brain develops, and that those changes can lead to different behaviors and possibly maladaptive coping skills or lack of coping skills. And then this is a separate model here too, with one of the proposed mechanisms. Basically, going through toxic stress puts your body in what people will call a fight or flight state, where you're just basically very activated, or that feeling when people experience normal high levels of stress, but you're permanently or often in that state because of your life circumstance. That leads to changes in the brain architecture that actually might result in kids having a decreased ability to calm down all the time. So being in a more hyper responsive or stress state all the time and have decreased ability to calm themselves and cope. So some examples of that might be a kid who has ADHD type symptoms or hyperactivity inattentive symptoms. And we do know that ADHD is more common in kids who have undergone some form of trauma. And then this is, I think, the last of the models I put on here, but basically all kind of getting at the same thing. This is from the ACE study itself, looking at how experiences we think lead to disrupted neurodevelopment, and then eventually adoption of, or higher risks of adoption of health risk behaviors that can lead to poor health overall. And then this is just I think a really powerful visual where you have an image of a 3-year-old brain who hasn't undergone neglect, and then a child who has experienced extreme neglect, and you can see that just the sheer size difference in the brain. So obviously there was a big impact from the neglect in the way this child's brain actually formed. And now we're going to move into more what we can do to promote health, because we know, like looking at the data from the ACEs study, that adverse childhood experiences are very common. And so we know that a fair amount of children are going to undergo these experiences, and some of them are not all things that parents have control over. So then it becomes very important to think about what we can do to try to buffer or minimize the impact that these adverse childhood experiences have, and just how to promote overall healthy development, even in kids, obviously, who not every kid has adverse childhood experiences. And then this is the concept that I was just mentioning. We think that this social emotional buffering, or basically a nurturing, consistent relationship with a caregiver, is the primary factor that distinguishes whether a stress that a child experiences is tolerable to that child, or it becomes intolerable and has the negative effects on the brain. So some of the concepts that I'm going to cover are talking about how to build those really healthy relationships and attachments that will be protective for the kids over the course of their lifespan. And this is just looking at overall health. How do we promote health? What contributes to health? And we know obviously genetics plays a role, environment, and then the experiences that kids have. And we'll be focusing a little bit more on the environment and experience piece. And as discussed, stable and responsive environment and relationships are crucial, as are safe physical environments. And then appropriate nutrition, which is not the subject of this talk, but just to, because I'm a pediatrician and have to highlight it, I wanted to just highlight that one of the most important, among other things, for promoting brain development is ensuring a kid gets enough iron. And so we know iron has a really big impact on overall development. And so ensuring an iron-rich diet, things like meat or eggs or lentils or dark leafy greens, Cheerios, or other iron-fortified foods are also very important for brain development, although not the focus of this talk. And then this is focusing more on the positive relationships that we're going to discuss further. And then having obviously a safe place to learn and safe place to be, both in their school environment if they have one, and then at home. So this is really getting into the specifics of the things that we can do with children of various ages to both help promote their brain development, their ability to learn to read, and to foster these close relationships that are so protective. So it really starts right when the baby is born. So I think often because infants don't always give the most feedback to the input that you give them, sometimes people think that their interactions are less important with a newborn baby, but that's definitely, we know that's not true. So things like holding the baby, talking to the baby, singing to the baby are all very helpful. We think that the interactions that are face-to-face are especially valuable. So looking directly at the baby and letting them focus on your face. And then responding to any of their little baby sounds that they're making or gestures that they're making helps let them know that you see them and you're responding to them. And then giving them interesting things to look at is important early on also. Young babies really like high contrast images, so things that are black and white often really capture their attention. And then just regular books and pictures are also great too. And this is some more stuff geared towards infants. As they get a little bit older, an older baby might be able to play peekaboo or little games like that, teaching them ways to communicate. So teaching them the yes and no, like nodding and shaking their head, and then reading books together really should start in infancy. Babies, especially under 1 or even really under 2, often put books in their mouth, chew on the books, touch the books. And sometimes parents try to discourage that, but it's actually great. Like, just let them do it as long as they're not actually ingesting parts of the book. It's great and all good for their development. And then this is moving more into toddlerhood. So this is really when kids want to kind of assert their autonomy and make some decisions. And you can definitely let them do that, but set appropriate limits. So we want to have really positive, nurturing, not punitive relationships with kids, but still set appropriate limits so that they can learn what is acceptable behavior or not. Be consistent. I think routines probably for this age group is among the most important. If they can have some predictability in their day, I think that helps their overall mental well-being, just because they don't really have a lot of autonomy. So being able to predict what comes next, like now I do breakfast, now I get dressed, I'm going to daycare, or I'm going to spend some time with mom after that, when's nap time, and a whole bedtime routine can be really helpful. And then making time to play with them, like actually getting on the floor, being basically not distracted, and having that one-on-one time is very valuable. And for this age group, I think toys that we think are particularly impactful for their development are things that allow creativity, meaning like there's not one way for them to be used. So things like blocks, they're animals, and they can kind of determine how they would like to play with them. Older toddlers start to ask a lot of questions. And so listening to them with patience and answering their questions is very helpful. And then a lot of kids get really into music in toddlerhood, which we think is very good for brain development. Hearing the rhymes, hearing the rhythm, dancing, all of that promotes development, and I think is something fun and can really be a relationship builder too. And then thinking about as they get a little bit older, socialization with other kids becomes important. And not all kids are going to go to out of home care, and that's totally fine. Depends on what's important to the family and what they value, but that peer interaction with kids in a similar age group is very important. So any way you can provide that, whether that's like a library group or meeting another caregiver for a play date, that sort of thing, can be very valuable for them to learn how to interact with each other. And then offering simple choices, which is just another way basically of giving them a little bit of autonomy. Musical instruments, like we talked often, kids really like that. And then I think the most important thing on this slide really is that we say that you should try to catch kids being good. So finding a desirable behavior and really highlighting how much you like that, how proud you were of that, just really celebrating all the good things that they do, much more than all the negative things. Because toddlers, if you've ever had one, you know they do a lot of things that require correcting, and so sometimes you can get in kind of a loop of being like, no, stop, don't do that, that sort of thing, and forget to really praise all the good things they do in between. So if you can skew the balance and praise them more than you're criticizing them, I think that that's very, very helpful. And then this is for kids of all ages. Again, really starts in the newborn period. Lots of warm physical contact and attention makes kids feel safe, secure, and loved. And all of that is very good for them overall. So that's starting with skin to skin as a newborn baby, we know has just tons of benefits. And then even as they get older, taking the time to give them a hug, sit close with them, and just letting them know that you're there physically. And then I think the other thing is obviously as kids get older, they have a lot of emotions, and letting them know that it's okay to be upset or frustrated and that you're still going to be there and you're still going to respond positively and warmly, you know, maybe not every time because no one's perfect, but trying to be there as a positive force, even when kids are maybe not behaving as you wish that they would. And then this is more information for all ages. Reading, as I discussed, is really important. It's an opportunity, obviously, for them to hear language, look at images, but also it's, as demonstrated in this photo, it's like time for close physical contact as well. Language, hearing language is very important, as discussed from the time you have an infant on. And that it is recommended that if it's a bilingual home, that parents speak in their native language or whatever language that they're most comfortable in, because that facilitates really the most natural dialogue, I think, between a kid and their caregiver. And if that happens to be a non-English language, then obviously they will get English outside of the home and get plenty of exposure there too, eventually. And then talking about screen time, this obviously gets a lot of attention and there's a lot of info out there about screen time. The official AAP recommendation is no screen time, ideally under the age of 24 months, so under 2. And that direct playing one-on-one is better than putting a child in front of a screen. That being said, for whatever reason, there are various reasons that parents need to use screen time as a tool. So I definitely acknowledge that. And something I like to tell families is that if you're going to do screen time, and you're able to, the less harmful form is actually sitting with the child and doing like co-viewing, where you're talking about what you're seeing and using it as a way to interact rather than just having the child watch it independently. Um, and then ideally, once they're above 24 months or over age 2, you are keeping it to less than 1 hour a day, if possible. And then this is the 5 R's of early childhood education from the AAP that I think summarizes nicely what we've talked about so far and just principles of promoting healthy development. So reading together daily as a family activity, um, spending time rhyming, playing, talking, singing, cuddling is all really great too. And then routines, as discussed, to help kids feel safe and secure. So developing somewhat of a routine doesn't have to be rigid, but just some predictability to a child's life is very beneficial. And then the next two concepts are rewards and relationships. So looking for that thing to praise, like every child has something that can be praised, and really being on the lookout for that and highlighting it will build a kid's confidence and make them feel closer to you. And then focusing on your relationship with your child as a foundation of healthy development. And now I'm going to move into the portion where I'm going to highlight some of the community resources and programs that I think are important for all caregivers to know about and can really facilitate a lot of the things that we were talking about. One of them is a program called Reach Out and Read. This is a nonprofit organization that integrates books basically into primary care medical practice, so primary care pediatrics. And it is a program that we actually just became a part of, we meaning Barton Pediatrics. So we actually have started already. The provider that sees your child, if they're between the ages of 6 months to 5 years and they're being seen for a well visit, will be providing a developmentally appropriate book. And that's basically so that all kids can have access to books. So if you get one between 6 months and 5 years, you're obviously going to build a little library of books. And we have them in both English and Spanish. And then it also helps us to see how the child interacts with the book and how does the parent interact with the book. So it can be helpful, I think, as a developmental screening tool. And then just use it basically as a tool to understand developmental milestones and talk about them more in office. And this is a program that's going to be facilitated by the Barton Foundation. And there is a lot of evidence to support doing this and taking part in this practice. So there's actually been several studies on this program because it's been around since the 90s. But it is shown to actually improve their children's language skills. And then I think especially important, increase the likelihood that families will read together outside of the office or going forward. So that is something that we're excited to be a part of. And then the next, I sometimes get asked in well visits or just general visits in the office, what are some ways or some parenting classes or ways to get more specific information about parenting? So all of these programs that I've listed here are evidence-based and ones that are promoted by the American Academy of Pediatrics. I wanted to highlight the Triple P positive parenting class that's on this slide. That is one that my developmental behavioral pediatrician colleagues particularly like because it's offered online and it's relatively low cost. But I'd say all of them, I have looked through these, really teach a lot of the same principles, and that the foundation really of all of these is developing this strong positive relationship with your child, and that if you have that, a lot of the other behavioral stuff just becomes naturally much more easy to manage, because the more interactions you have that are challenging with your toddler or young child especially, they will often push back on that. And so the idea is not to be permissive and let kids do whatever they want. It's to set boundaries that you deem appropriate as the parent or the caregiver, and then try to enforce those in a way that is respectful and kind, and maintains the safety and security of the relationship. But these are definitely good resources to check out if you want more specific information, more guidance with this style of parenting. And then the parenting pyramid is from The Incredible Years, which is one of the resources that was listed on the previous slide. I really like this, just looking at the yellow slide. This really kind of highlights all the things I've just been talking about. The stuff that's at the bottom of the pyramid is stuff that we would encourage parents to do the most of. So expressing empathy, giving them lots of attention, playing with them, helping them to problem solve, listening to when they're talking to you and engaging. And then as you go up, giving those rewards and celebrations of good behaviors or other behaviors that you are happy to see, and giving them lots of praise. And then obviously we need to set some limits. We're not going to let kids do whatever they want. So that's an important part of the pyramid too. And then the things at the top are the things that should be things that maybe everybody needs to use occasionally, like offering consequences, like taking away a privilege or putting a kid in a timeout. Those are things that are tools that can be helpful and might need to be used, but are not things that should be like your immediate go-to, like going to right away when you see a behavior that you may not like or want to discourage. So I think it's a helpful framework overall. And then a few other things. So we know that early quality or early high quality education has tremendous benefits for child development. And so that's a lot of the push for getting kids into some type of preschool or educational environment before they start kindergarten. That's not a reality for every kid, and I don't think you necessarily need to do that to be successful long-term, or for your kids to be successful. But there are some proven benefits of early childhood education in a preschool setting or other high-quality setting. And so some of them are listed here. They're more likely to graduate high school, have higher test scores, fewer behavioral problems, improved peer relationships, which I think makes sense, having opportunity to engage with peers early on. And then there is an association with lower rates of child maltreatment and neglect for kids who attend high quality early education. And then this is to highlight the early Head Start and Head Start programs. We all know, if you are a parent of young kids or a caregiver of young kids in this area, that childcare is extraordinarily expensive, and it is cost prohibitive for a lot of families. And so early Head Start and Head Start are federal programs that were really designed to give kids some of these advantages that you get in preschool, in an affordable way, basically. So you do have to be a lower income family to qualify for this, but I think it's an excellent program. Early Head Start really starts from pregnancy, and then often they will work in the home with families of kids under age 3. And then Head Start is more of a traditional preschool model, traditionally kids age 3 to 5, really helping with that school readiness, promoting their early literacy skills. And some of the other potential benefits or aspects to the program are listed here. But I think another one is just that anyone who's involved in Head Start is often very knowledgeable about what's available in the community. So if your family has a particular need, they can be an asset in identifying things that might help the overall health of your family. And then these are just looking at outcomes of early Head Start. And so that's the program where you're starting very early, maybe earliest pregnancy through age 3. And looking at the kids at 3 years, they're shown to have larger vocabularies, which is great. better problem solving, and then improved social and emotional development. And then looking at parents' outcomes, again, more likely to read to their children daily, which I think is excellent. And then I think being more positive with their child, which I think is really incredible, and just having, I think, a more broad range of discipline strategies. And then early intervention, I wanted to mention because some kids are always going to have developmental differences, and even in the most ideal environment that someone could create for a baby, there are kids who are going to have developmental differences that are not necessarily a bad thing at all, but can be different than what we would call typical development, or things that might require some intervention, essentially at an early age. So we have early intervention available here locally, and our early intervention here in El Dorado County is through the Alta Regional Center. So if you do have a concern that your child might be delayed or developing in a way that isn't considered typical, this is an excellent resource, is going to the regional center. What I would recommend is definitely talking to your child's pediatrician and letting them know your concern. And I think our role is really to talk that through and see if we think it's kind of something that needs intervention, or maybe is kind of typical for child development. And then if it does seem like it's something that could need intervention, maybe something like a speech delay or gross motor delay that could benefit from something like physical therapy, we can help get you connected to the regional center just by providing you the information. It's from basically infancy through age 3. So technically 35 months is the cutoff for referrals, I believe. And anyone can place the referral. So a healthcare provider can refer kids, and then you as a parent or a caregiver can also place a referral. So we typically will provide people the information about Alta Regional Center and the contact information, and then ask the parents to kind of go from there and make the contact. And they, from there, will do a very comprehensive evaluation of the child and the family to see where they are developmentally and what, if any, services they could benefit from. And so it's very comprehensive, and looking at the child and family overall, and a great way to get connected early to improve overall developmental outcomes. And we know that there are huge positive impacts basically for intervening basically as soon as you are concerned about a developmental delay, or your healthcare provider is concerned about a developmental delay. And we know these are some of the positive outcomes listed here, that basically they have improved educational outcomes. And then we also think they have improved social emotional outcomes as well. And I think going through the process, they really do teach you. I've been through this process with my older son, and I think part of getting connected to services is just that they teach you how to be an advocate for your child's best interest and really understand where they are and what they might need going forward. And this is to kind of wrap it up. I think the other important thing to remember on this subject is that there's so much emphasis on the relationship between the child and the caregiver. But we also, in order for that relationship to be positive, that you have to take some time to make sure that you as the caregiver are healthy as well. So something that we as pediatricians are interested in knowing about is if you are undergoing any challenges that make it hard for you to care for your child or parent your child, we would like to know about that and help with that. Things like mental health, we can definitely help provide resources and get parents connected so that the whole family can benefit, essentially. But all parents or caregivers have come from different backgrounds and may have had a very positive childhood, or maybe not so much. And sometimes people who are in the latter category need a little bit more help with challenges that help them maintain the ability to use a positive parenting approach. So we definitely acknowledge that it is very important to value the health of the parent in all of this also. And then this is our last slide to sum it up, is basically that your kids don't need you to be perfect is the thesis of this slide, or the main point. Kids do really well if they have a safe, stable environment, and that they have a nurturing relationship with you, and that you're not expected to respond perfectly to your child every single time, and that they really don't need you to do that. They just need safety and consistency, and that that alone really is what helps kids thrive and do well in school, and develop their brains so that they can later live healthy lives as adults. So I think I'll stop there and see what questions have come up.
Great. That was wonderful. Just as a reminder, if you have questions, you can ask in the Q&A box at the bottom of your Zoom screen, or you can enter it into the chat. We can even try, if you want to ask it live, you can raise your hand and we can try it that way too. I know sometimes that's easier. And before I get to some of the questions, Silka, one of our family specialists for the Office of Education and the El Dorado County Commission Hubs, wanted to make sure, or I'm sorry, County Community Hubs wanted to make sure to mention that in addition to Head Start, that EDCO offers a state preschool, which has a much higher income level that many people may not be aware of. So I'm happy to enter that into the chat, Silka, if you want to include a web address on that. And then another question was just, I think, asking Dr. De Silva about how patients can access your office. Do you see Medi-Cal clients, and maybe explain how you're connected to the community health center?
Yeah, so Barton Pediatrics is located in the community health center. So we absolutely see Medi-Cal patients. I'd say that's actually the majority of our patients are Medi-Cal. And we are right now, so I am one of the pediatricians. Dr. Shaw is another pediatrician. And then Molly Dowd is one of the pediatric nurse practitioners. And Tessa Amos is a family nurse practitioner who's working over on the pediatric side now. So there's 4 of us providers, and I'd say actually availability and accessibility has been pretty good recently. So we are accepting new patients. If you want to make an appointment, we're happy to maybe we can put the number in the chat if that would be helpful for people. And then for patients who are already established, we have had a fair amount of same day appointment availability. And then we do also have what we call 72-hour appointments. So they open 3 days basically before the appointment date and time. And so we always have basically some appointments on reserve for people who have last minute things come up. But in general, it's been pretty good recently. And then Barton is actively recruiting pediatricians. And so we anticipate having another pediatrician start in the fall as well.
Awesome. Yes, I will include the phone number in the chat for everyone. And I just sent the link for the EDCO program as well.
Yeah, thank you for that addition. By the way, I think that's really helpful for people to know, because I'm definitely new to the area, and we do have the EDCO applications at the front, but it isn't one that I highlighted in this. So I'm thankful to that, because I think that could be a huge benefit for a lot of families.
Absolutely. Another question came in. What are your thoughts on high stress levels and fat content in the diet for young children?
I think I just want to ask a clarifying question, like how are we asking if those things are related, like eating a high fat diet is related to high stress levels?
Would interpret it that way, and if they want to clarify, they're welcome to, but maybe
okay. Yeah, feel free.
start there. Yeah.
I do think that there's data to suggest that high stress and high cortisol basically makes people hungrier. And so people who are tired or otherwise stressed are less likely to make good, healthy food choices. I think most of that data is probably in adults, but I think it would be safe to say, although I haven't read the studies myself, that that's probably true for kids too, who have less, executive functioning or ability to make a healthy choice anyway, that probably when they're more stressed, they would be more prone to wanting a high fat, high sugar diet. And that we definitely know that that could be used as a coping mechanism.
Yeah, I think to clarify, I do recommend higher fat content when cortisol is higher. That was the clarifying comment.
Oh, got it. I don't think that's not a recommendation that I necessarily would make, but I think looking at overall nutrition data, that if you had to choose between like a higher fat content or a higher carb sugar content, that it's probably safer to go the higher protein, higher fat route anyway, as long as it's healthy fats, obviously.
Great. Let's see. What is your stance on the food coloring ban in California? Just a couple comments about the
Yeah.
positive
Um,
that.
so sorry about the lights in here. I was in clinic today, and so I did this in the office, not realizing that the lights stay on all day because we're in and out of these rooms and they're on a motion sensor. So next time I won't do it in a room that the lights keep turning off. And so I think as far as food dyes go, I know I have learned from my developmental behavioral peds colleagues that they do think that there's some association in food dyes, particularly red food dyes was the last that I had read, with basically undesirable behaviors and poor behaviors, especially in non-typically developing kids. And so I think that there's some evidence to support that practice. It's not something that I've looked into recently. I will say with my own kids, it's not something that I'm not convinced enough by the data that I have implemented being really strict about food dyes with my own kids, mostly just because one of them's a really picky eater, and I try to just get healthy anything they'll eat in for the most part.
Great. And just so I'm keeping everyone up to date, the wonderful library and the community hubs are including links to their programs. They have a lot of great programs for children ages 0 to 5 that are free and available to the community. So just wanted to make sure that that was included and made clear. And Silke, or Catherine, if you want to speak more on that, you can just raise your hand and I'm happy to allow you to speak, just because that might make it easier. I'm gonna let Silke just have a couple words. Let's see. Silke, is that working for you?
Can you hear me?
Yes, we can hear you.
Yeah. Thank you so much, first of all, for the amazing presentation, Audrey. That was so comprehensive and really neat. Nice to see all the information in like one place. Yeah, thank you for letting me speak for just a moment. I didn't realize Catherine was there too. So I work for the Office of Education and the Community Hub, and many of the things that Audrey just talked about is things that we teach in our parent-child classes or groups. We just have a lot of different offers for families specifically. And most of our programming happens at the South Lake Tahoe Library because the Community Hub, the El Dorado Community Hub, is a part of the library. And so I just wanted to point that out for people, that that is a resource. So many of the ideas to promote child development and healthy growth is what we talk about in these groups. There are, play groups, and then part of that is always like a little parenting topic. And then, of course, there's story times too, where all that early literacy that you mentioned will be promoted. We also support actually anybody in the community, so people don't have to have children. We get a lot of walk-ins, and people, part of health is, of course, or community health is also, people's housing and whatsoever. So we get kind of questions, and we promote or we connect people to resources in other areas too that are not necessarily child related. But in the child area, we also refer people. We do little developmental screenings. We refer people to Alta, like you mentioned, and to the school district for further assessments. And then one final thing I wanted to mention, because there aren't that many like parenting classes locally around. I'm actually offering a little parenting class. It starts in the beginning of April. And it's not an evidence program of like the ones you mentioned. It's a little bit more of a free exchange for people to share their own experiences, ask their own questions. And we make that based on the lessons of the book, How to Talk So Little Kids Will Listen, which is, I think, a really fun book. So everything the Community Hub does is free. And yeah, just hoping I put my contact in the chat, because not quite everything is mentioned on the library calendar. We have a newsletter that we send out regularly, and yeah, happy to talk to people and include you in what we're doing. Okay, thanks for the opportunity.
Thanks, Silke.
Yeah, thank you so much for sharing. I really appreciate that. I need to get on the newsletter list too.
Yeah, we can make that happen. We'll help. There was one more question, and if you do have any other questions, this is, I think, the last one, but feel free to sneak it in there and I'll ask on your behalf. But the question, just you mentioned early in the presentation about a connection to ACEs and ADHD. Could you speak more to that?
Yeah, I think the idea is that trauma, basically any form of trauma, so it doesn't have to be necessarily ACEs as defined in the study, but going through a traumatic event can lead to behaviors that are often very similar to ADHD or kids who are actually diagnosed with ADHD. So having like the hyper responsiveness, difficulty concentrating, basically challenges with concentration both in school and home settings, we think is directly related to the trauma itself. And so some of those kids will end up, they just get basically treatment in the mental health realm, and some of those symptoms start to improve, and then other kids go on to being diagnosed with ADHD. There is a big genetic component to ADHD, so it's sometimes hard to know, how much is genetic and how much is related to the experience that the child has had. But we do know that early experiences of trauma the later effects can present very similarly to ADHD.
Great. We did get another question. So I'm going to ask, is there data on development between children who attend daycare versus children who are cared for by a parent?
I think that the data that I was mentioning is it's mostly looking at preschool. So like, did they get any type of education in a school setting with peers before attending? There's obviously a lot of variables in that when you're looking at the overall outcomes, because preschool doesn't have to be, but is often very expensive. And so the kids who are in that may be of higher socioeconomic status and might have other advantages that affect their development. So we do have data to show that it helps developmentally to attend preschool. But I don't think that means that you can't achieve the same outcomes by doing the similar things that preschools do in a home setting, as long as you can facilitate that peer interaction somehow. There's a lot of people in my life who've chosen to go that route, and the experiences that they provide their kids and the activities that they do with them are so rich that I think it's hard to believe that wouldn't be comparable to just a traditional, or maybe better than a traditional preschool environment. So I think both ways can be good, but we do have data to show that it is beneficial to attend.
Excellent. I'm not seeing any further questions, but again, I'll start to wrap it up. If you do have one you want to sneak in, I am happy to ask it. But just reminding folks that this webinar was recorded tonight. You can see it hopefully later tonight on our YouTube channel, and we'll get it up on Facebook as well. So if you want to reference it, I did get a couple questions and requests for that, which I think is an excellent sign of how well things went tonight. And then just also, we will ask a closing survey once this webinar concludes. We love to get your feedback. How did we do tonight? And then if you have future topics you'd like to hear from us on, we would be happy to hear more about that. But I don't see any other last questions. So Dr. De Silva, thank you so much for being here tonight, and thanks for all that attended. I hope you have a wonderful rest of your evening.
Thank you so much.